The hamstring muscle is a very commonly injured muscle group in sport. It's not because it's an inherently fragile muscle group, but oftentimes it's because we don't train it correctly or we don't rehab it correctly after injury. So we get this cyclical injury. So it's injured, heal, start moving better, re-injure. Heal, start moving better, re-injure. So what we want to do today is go through our 4-step process in how we deal with hamstring strains. The first step that we do is evaluate and create. We want to know what's going on. So we look at the hamstring for two things. We look at the active mobility versus the passive mobility. We have two good tests for that I'm going to show you. From this information and other things that we talk about during your assessment, like your goals, what you want to do, where you were, stuff like that, we can create a plan. It depends how much help you want, how much help you need, and how much performance you want. So that first step, evaluate and create. Look at what's going on, see where you want to go. Is Norcal Physio the bridge that can get you from here to there? Step number 2 is alleviate the pain. We're going to use some self-mobilization techniques here that you can do on your own. There's a lot more that we do in the clinic. We do a lot of cupping, scraping, body tempering. We want to figure out where the source of irritation is, try to decrease that pain. Why do we care so much about pain? To be fair, most of us don't really care too much about pain. We care that the pain is getting in the way of our life. We can't train hard, we have to stop early, it's decreasing our performance. But we have to take pain away, because if we don't, we're going to have this really clouded judgment of where that issue is coming from. Because step number 3 is we want to fix the cause. If we focus on the cause, what we're going to find is that pain is just relieved along the way. Because for all of us athletes, our main goal is to make sure that we have longevity in our sport. We want to be the best of the best for as long as possible. And to do that, we want to fix the cause of the pain. The nice thing, again, the cause of performance limitations is the cause of pain. So we focus on the performance, focus on why we're not moving well. Pain just goes away on its own. Two things we're going to look at there. We're going to go back to the eval and look at that active versus passive, but now we're going to call it hamstring control versus hamstring mobility. So we have evaluate and create, alleviate the pain, fix the cause. The last step is build resilience. This stage is where physiotherapy meets performance training. This is the fun part. What we're going to do is some variable loading. We're going to do some explosive quick movements, and then we're going to do some slow eccentric movements. So evaluate and create, alleviate your pain, fix the cause, build resilience. We're going to go through this with every single patient, whether it's hamstrings or headaches or elbow pain or big toe pain. That's our method. Today we're just going to look at it specifically for hamstring strains. So the first step we want to do, so the first piece of this puzzle is that evaluate and create portion. We want to see where you're at. What are the hamstrings doing? Why do you keep getting this injury? Now, to be fair, hamstring pain can be caused by a lot of things. It can be caused by sciatica, low back referral, mid-back mobility issues, overpronation of your foot, a whole list of things that we need to assess. For the sake of argument, for the sake of decreasing complexity, we're just going to say that your hamstring pain is caused by your hamstrings. The two things we're going to look at, active mobility and passive mobility. Active mobility is how far you can move your leg. How far can your muscle move your leg? That's it. That's super easy, right? What we find is that a lot of people think that they have good range of motion and maybe their passive mobility is fine, but a lot of times they're just so limited and they don't realize it. So what we're going to do here is super easy. You're going to lie on your stomach, face down, everything nice and flat, and all you're going to do is bend up your knee. Try to get your heel as far as you can towards your hip. So right about there is my limitations. I think I'm going to have a hamstring cramp if I do any more. So that's our active mobility. Maybe that's the full motion. We don't know. But let's take the other foot, see how far we can get it. Do you see how much more mobility I can get there? I stopped right about here, and I was able to go even more. So that means my active range of motion is much less than my passive range of motion. Normally we like those things to be about 90% of each other. The problem is that we get in these weird positions during sport, especially the dynamic sports like soccer, volleyball, basketball, football, and we can't control the body in that range of motion. Even at the end of a squat or a deadlift, a lot of times I find that people can't control it, so they just bounce out of that hole. So that's one thing that we're going to want to work on, and we're going to get to that when we get to the fix the cause section. Number 2 is going to be passive mobility. So how far can your leg actually move? So we looked at the active mobility of the hamstrings. That's bending the knee. Now we're going to look at how far the knee can straighten. Now, to be fair, my hamstrings are absolute trash, and this is something I need to work on. Probably why I have recurrent hamstring pain. Knee's going to be up, pointed towards the ceiling so that your hip is at a 90-degree angle. You're going to hold that with your leg. That way your hip flexors don't have to work. Hold it with your hands, excuse me. And then all you're going to do is straighten the knee as far as you can. We should see about 70 degrees of motion, and that is significantly limited there. I'm getting some tingling down into my foot and my calf. Everything's tight and on fire. So that's something I really want to work on. This is my good leg. Let's go ahead and switch sides and see what this side looks like. So here, knee to chest a little bit, knee pointing straight up, straighten the knee, and that feels much worse to me. So my active mobility is quite limited, and my passive mobility is quite limited. So 2 out of 2 things I failed on. The next thing we want to look at is how to decrease the pain. A lot of times in the hamstrings we get this nasty, throbby, achy sort of pain that just limits our mobility, limits our ability to fire and activate. We have pain inhibition and we have fear inhibition. A lot of times it comes into play in the hamstrings because these are big muscles. There's a lot of nerves, there's a lot of proprioception and feedback into the brain. So the body just stops working so well when it doesn't want to work. It's a protective sense that we get. So what we're going to do here is try to decrease the pain. Again, we are just saying for sake of argument that the hamstrings are the cause of your hamstring pain. So what we're going to do is some soft tissue work with the ball. You can use a lacrosse ball, tennis ball, softball, whatever you want. This is just one of those mobility balls. You're going to find that nasty, uncomfortable spot in your hamstring, and you're going to put the ball there. You're going to load weight onto it as much as you can tolerate. And I just want you to sit there for about 30 seconds. So this should be uncomfortable. It should not be painful. We're going to go through 3 different techniques. Pick which one works well for you, and then just skip around between them. So the first one, loading that spot, try to relax the muscle, let the ball sink into the muscle. Then what we're going to do, option number 2, is a contract relax technique. So find that spot, whatever is really uncomfortable for you. Right there is nasty for me. And all we're going to do is contract the muscle. Really get that muscle to tighten. Hold that there for 5 seconds. And then relax. Let it come down. Tighten. 5 seconds. Relax. 5 seconds. Tight. 5. Relax. 5. I like to repeat that about 5 times. So the first one, just sinking in about 30 seconds there, 2 or 3 times. This one, contract, relax. 5 seconds, contract, 5 second, relax, and do that about 5 times. Third option is pretty much the one I like to do primarily because it gets a little bit of active movement in the muscle. So again, same spot. We're going to find that nasty, irritable spot. You're going to have a bunch of places. I'm sure I could find 5 or 6 in my hamstrings that are nasty. We're going to load weight onto it. And then we're going to get the muscle to move underneath. So we're going to go into knee extension and then back down to knee flexion. So we're trying to get that muscle to work, trying to get it to move a little bit. Again, 5 seconds or 5 repetitions. Take a little break and then do 5 again. So how much pain is too much pain? For this, we're going to keep it nice and easy. We're not going to talk about a pain scale from 0 to 10. All we're going to say is that it's up to you. If you can breathe through it, if you don't have to hold your breath, if you're not turning red, then it's probably fine. More does not mean better though, so make sure that it's a tolerable range for you. One thing I do want to mention is that this is a really good technique for chronic hamstring pains or acute pain that does not cause any tissue disruption. If you have a high level strain or if you have a muscle tear, this is probably not the best thing for you. You need a little bit of different techniques, a little bit more finessing. This is great for some people, not good for other people. Do what you want with it. All right, so at this point what we've done is we've evaluated the condition, we've created a plan. Do you have active mobility or passive mobility limitations? My answer is yes, I have both. We did the alleviate your pain section, soft tissue mobilization with that lacrosse ball, tennis ball, or whatever. Next we're going to do is fix the cause. Look at the control and look at the mobility. Since I have both limitations, we're just going to do one and then the other. So for this one, what you need is a band. Something strong, something that doesn't stretch too much is going to be the best, because we're going to try to get to that end range of motion and then do eccentrics with the hamstring. What we want to do is use your muscle through as much of a range of motion as you can, add a little bit extra at the end, and then use the muscle to control from that range all the way back down. So the hardest part of this exercise is really getting set up with the band. The band's going to be around your ankle like this, and you're going to be lying down, face down. So just like this. So right here, I'm going to bend my knee as far as I can. Doesn't move very far. Then with my hand, I'm going to pull a little bit more. See how much further it moves. Hold it with my hamstring. Let go of the band. Let it come back down. Bend up. A little bit of help. Hold with the hamstrings. Back down. So I don't need to go through the full range of motion, because from full extension of the knee to my end range, I'm fine. And because it's a little hard to do this with the band going through that full range of motion. So here, hamstring, back down. Okay, if that's a little bit challenging to you and you want a little bit of a modification, grab a chair and you can do it sitting down. So sitting down here, half on, half off the chair, bend up as far as you can. With your hand, pull a little bit more, hold there, and then back down. Bend up, pull, hold, and then down. Basically the same concept between these two exercises. Use that muscle as far as you can. Passively get it through the rest of the range of motion. Use that muscle to hold as much as you can, and then slowly bring it back down. Just forewarning, you're probably going to cramp during this exercise, so start off nice and slow. Do what you can. So that's active mobility. Can we get it through the full range of motion? Next thing we want to do is look at the restrictions. So what's that passive mobility? A lot of times our first step is just to reach down, touch the toes, say that's a hamstring stretch, and call it a day. The muscle is tight for some reason. We don't want to fight the body on that. Again, it's probably one of those protective senses that the body is just saying don't lengthen. We don't want to do it. So what we're going to do is encourage the body to relax without actually going through that full stretch. We're going to lengthen the muscle, we're going to activate the muscle, and try to load the muscle through that full range of motion. To do that, let's get a band, or you can do kettlebell or dumbbell, whatever works better for you. I'm just going to use a band for this demonstration. Go ahead and step on the band. Then get into like a kickstand deadlift sort of position. 90% of the weight should be on the front, 10% should be on the back, and you're going to stand up with the band. From here, we're just going to do a hip hinge position until you feel a big, strong stretch in the hamstrings. Hold that there for about 5 seconds. And then we're going to pull, activate the hamstrings, hold that for 5 seconds. Let it come down again. Big hamstring stretch, a little bit further this time. 5 seconds. Pull, activate, 5 seconds. So again, we're not going for a static, long duration, heavy load stretch. What we're trying to do is lengthen the muscle, and then from that lengthened state, activate the muscle through that range of motion. Okay, so evaluate what's going on. Alleviate the pain. Is there anything that's clouding our judgment that will distract us from the true cause? Fix the underlying cause. Why do we keep getting these recurrent irritations, injuries, strains? Is it active mobility? Is it passive mobility? Or is it both? Fix that. Next step is build resilience. We're going to go through some variable training, variable loading. All right, so continuing on with hamstring strains. We've talked about how to evaluate and how to create a plan. We've talked about alleviating the pain. We've talked about fixing the underlying cause, whether that's mobility or control. Now we're going to talk about resilience. What we want to do with resilience really is think about what you do in life and then make it much worse. We want this variable load because not everyone always sprints, not everyone always jumps. You don't always lift heavy weight. You have to be trained and you have to be able to do all of it. So what we're going to do is two. We're going to do one that really works on loading the hamstrings through the full range of motion, and we're going to work on one for that fast twitch, fast contract, relax ability for your hamstrings. The first one we're going to do are going to be a modified Nordic curl. We're going to modify these because they're super hard and no one really does them correctly unless you're super well trained. So what we want to do is start in a position and in a movement that you can actually do successfully. So what Jessica's going to do is she's going to kneel on the table all the way over here facing the ball. So the Nordic curl is when everything stays still except the knees. So all the movement should be coming through the knees. The ideal scenario is that the body stays straight, you come down, barely touch the table, and come back up. Now that's ridiculously hard, so we're going to make it a little bit easier. She's going to keep everything nice and tight. She's going to use her hands to roll the ball forward, add a little bit of support, and then roll the ball backwards. To keep the feet stabilized, I'm just going to push down on our ankles. So the way to set up is make sure the stomach and the spine is nice and organized. The hips are tight, pushing forward. Keeping your eyes forward, you're just going to lean forward and roll down. Roll, roll, roll until you feel like you're going to fall forward, and then coming back up. Good. So glutes tight, hips straight, abs tight, spine organized, and just going down again. Good. You notice one compensation that she's using is she's bending the hips forward as she comes. So what I want her to do is think about really tightening the glutes, really squeezing forward as hard as you can. Keep that hip in good extension. We're just going to do one more because I think she's already fatiguing. So going down, at this point, tighten the glutes hard, 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 and then coming back up. Still a little bit of difficulty with that, but much better control through the hips as she's going through that. Okay, so that is loading through the full range of motion. Now what we're going to do is that quick contract, relax to help the hamstrings work in a different quality of movement. So you're going to be on your stomach, face down, either way. You're going to have a friend, or not really a friend if they're doing this with you, because this is kind of torture. They're going to hold the ball right here. Make sure you have your grip nice and tight because there's going to be a lot of force coming through the feet. What Jessica's going to do is kick the heels onto the ball as hard as possible, one at a time. So starting off nice and slow, bend that knee up and then back down, then left and then right. So now what we're going to do is gradually increase the speed until you're going as fast as you can. Make sure you're going through that full range of motion. Again, trying to go as fast as possible, hard as possible. Really try to pop the ball with your feet. See if she can go faster, 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 faster. And it should be starting to burn right now. Keep going, keep going, keep going. You got to hit 30 seconds with this. And stop. So we have the Nordic curls, which lengthen from a short position all the way to the long position. A nice gradual, slow, eccentric movement. And then we have the tantrums, really focusing on that quick activation, relaxation of the hamstrings.
So again, hamstring injuries are super common in sports. Doesn't matter what sport you are, it seems that there's always hamstring strains. It's not because the hamstrings are terrible muscles. It's because they're often not rehabbed correctly, they're not trained correctly, and it just predisposes them to injury. So when you're going through it, remember these. Evaluate and create, understand what's going on. Alleviate the pain. We want to decrease pain so that the muscles can fire, so that our vision is not clouded. Fix the cause. Why did this pain, why did this injury actually happen? We're going to look back at our evaluation. Is it mobility or is it control? Fix that. Once you're done with this part, we really care about the resilience and the performance. Get that variable load. Get that quick speed, get that slow speed. Make sure that you load it up heavy. We did not do any heavy loading, but really something else you should do with this is heavy deadlifts, heavy snatches, heavy cleans, anything that can get those hamstrings activated fully. If you have any questions about this, if you don't want to evaluate yourself, which you shouldn't, give us a call. We're here to help with hamstring injuries, headaches, shoulder pain, everything. But really, if you're an athlete, if you're dealing with hamstring pain, come and give us a call.